Good afternoon, everyone. Interestingly enough, when Dr. Sheftel and I were planning this session, COVID and cold weather considerations for your practice, we hadn't anticipated we would already have had a record snowfall and the coldest morning in almost 10 months prior to it even being presented. Nonetheless, we're so glad that you're here with us today. I know many of you recognize my voice, but for those of you who do not, I'm Nicole Cass, the CE Program Manager for the MVMA, and today's moderator. So as your moderator, I ask that if you have any questions to please type them in the Q&A area and we'll address them at the end of the presentation. With that said, I'd like to introduce Dr. Joni Sheftel. Dr. Sheftel is Minnesota's state public health veterinarian, and she leads the Zoonotic Diseases Unit at the Minnesota Department of Health. She has a longtime interest in veterinary and agricultural occupational health. In addition to her DVM, she has a Master's of Public Health in Environmental and Occupational Health. For the COVID response, she is assisting with the Minnesota Board of Animal Health on pets with COVID and is leading the workplace cluster response, working with other Minnesota Department of Health epidemiologists, local public health, and the Minnesota Department of Agriculture. Dr. Sheftel currently serves as the immediate past president of the MVMA. Please go ahead, Dr. Sheftel.
Hello, everybody. I'm just going to leave the video on long enough to say hi. And if you notice blood streaming down my face, it's because right before this webinar, this new 7-week-old kitten we have bit me right in the cheek. And anyway, I'm so happy to be here, and I'll see you back under the question period. Okay. We're going to talk today about the current situation in Minnesota from the perspective of small workplaces like veterinary clinics, what to do to prevent spread in the veterinary setting, what to do when you have an employee with symptoms, what to do when you get your first COVID positive employee, and then back to the title of this talk, how, now that it's getting cold, how can we let clients back into the clinic as safely as possible? The situation in Minnesota now actually couldn't be worse. Unfortunately, we had a little, serious situation in early spring, and then a resurge in midsummer, and now our fall surge is bigger than both of those practically put together. Our deaths are up, our hospitalizations are up, and the number of cases is climbing basically every day. And it's not just a metro problem. The cumulative incidence, by that I mean the number of cases per 100,000 people from the beginning of the pandemic through the 23rd, or basically through now. And the highest incidences in our state are actually in greater Minnesota and Hennepin County, although they have 33 plus almost 34,000 cases now, are 18th or 19th down on the list in terms of incidence, so cases per 100,000 people. You can see it's a problem that's affecting our entire state at this point. And in fact, Roseau County, which has been, has pretty much not had many cases until now, is having a surge. So it's just not safe anywhere in Minnesota. We're seeing cases everywhere. And the cases are generally in working age people who work in veterinary clinics. And you know that the largest number of hospitalizations are in people over 60, the largest number of deaths are in people over 70, but the largest number of cases are in working age people. This is a look at all of the workplaces with COVID-19 cases from the very beginning of the pandemic through the end of May. And you notice there aren't very many dots, and the dots there are very big. That's relative to the number of cases they have in one place. And almost all of those very large dots are meatpacking plants, large distributors, very large manufacturers. And there weren't that many clusters of cases in small workplaces, but that has changed. And this is what it looks like from June 1st through now. And they're just a bajillion little small dots. And actually, the meatpacking plants and the other large distributors have got their situations under control enough So they are represented, if at all, by smaller dots. And the bigger dots tend to be places with multiple locations like grocery stores and grocery retail outlets. So, at least to my knowledge to date, and this is just people calling me and asking for help, at least 13 of those tiny little dots are veterinary clinics. And veterinary clinics are critical infrastructure, and veterinary personnel are essential workers. That means the rules are a little bit more business friendly for veterinary clinics, and a little more complicated actually, because you have to explain sometimes why you don't have to do what everyone else is doing. And this is the guidance that you should be using as a veterinarian. It's available on the website at the URL below. And if you have any questions at all, just email me or email our critical infrastructure workplaces group email, and we will send you all the documents and PDFs if you prefer. So this is the very beginning of every story, right? Is how is this disease spread? And it should be obvious enough, but there was so much confusion at the beginning of the COVID pandemic here in the United States, so much confusion about other people's stuff, touching things, surfaces, Clorox wipes, hand sanitizer, that you might have thought that this disease was spread from hand to mouth, or through direct contact like that, but it's really spread through aerosols produced when someone either coughs or sneezes or even talks. And we've gone beyond droplets now. We know it's spread by droplets, but it's also spread through aerosol transmission in many cases. And this is really important to keep in mind, because you look at how to prevent disease by how it's transmitted, basically. So the most important practice is prevent workplace spread in any workplace, and we're going to go through these a little more carefully. First of all, employee screening. Secondly, isolation and quarantine. We're going to go through details on all of these. Distancing, mandatory masking, and other personal protective equipment. Granted, masks are not called personal protective equipment. That's kind of a fine point. And then cleaning and disinfection. And you notice that cleaning and disinfection is at the bottom of the list because it is the least important of all of these things. It's really important for keeping employees feeling safe at work, but it's less important for preventing transmission. So the most important practice is employee screening. And it's basically a two-step process. In the first step, you ask every employee, every shift, 5 symptom questions. And these symptoms are sore throat, cough, fever or feeling feverish, muscle aches, or shortness of breath. You can take a temperature. A lot of the big companies take temperatures, but 30% of our cases do not report having a fever or feeling feverish. And so just temperature screening alone is not going to get you out of this hole. And it's not at all the most important part of screening. Then if someone says yes to any one of these 5 symptoms or has a temperature above 99.5, which is the high end of the human normal temperature, you go to step 2, which is sitting down with the person and one-on-one, a person with judgment, often a manager, office manager, owner, to figure out what is going on with this person. Are they okay to go into work? They have a really good explanation for what is going on. Let's say their temperature is 99.7. They just ran 5 miles before work. There are explanations for any of these symptoms that would not require being sent away, but it does require secondary screening. So then you figure out if they're okay to work, or they should be sent home for testing, or if they're really sick, straight to the medical clinic. Again, our policy is to help keep businesses open and running. And employee screening is the most important thing you can do. And what we're looking for is screening out people with even mild symptoms, because this disease has got the widest range of disease severity of any disease I've ever worked with as an infectious disease epidemiologist. everything from some of the mild headache to being dead. And on the spectrum, this disease can be found. So if anyone has one of those 5 basic symptoms, or of course, if they say that they've lost their sense of taste or smell, we want them to go get tested. And what we want to develop in every workplace, even a small workplace like a veterinary clinic, is a sustainable system of screening and testing that identifies and excludes ill employees on a continuous basis to keep the clinic going, to protect everyone in the clinic. Because the reason that employee screening is the most important is this disease is spread through aerosols, and the most important thing you can do is keep sick people out of the clinic. And what we're finding actually in small and large workplaces, that screening is the Achilles heel. It's often skipped altogether in small workplaces. People assume that because everyone you work with so well, and you've had all this education, you've talked about COVID, that you assume that your coworker would not come to work or your employee would not come to work with COVID symptoms. But I can tell you from 7 months of experience now working with workplaces and COVID is that assumption is completely wrong. And you know who it's most wrong for? Is the owners, the managers, the people running things. We are the worst at going to work when we're sick, and we can justify it in a number of ways. Oh, it's my asthma. Oh, it's my allergies. Whatever. We show up to work with symptoms and we make people sick. I have my own personal experience with that because I started an epidemic at the health department on influenza when I decided that my symptoms could be my allergies, and I went to work. Anyway, even though I had a fever of 102. So I know it's something that we all do. For COVID, we really need to get a handle on it. We have some helpful documents. This one is called Employee Screening and Testing Recommendations. It talks about how to do it. And then this one is for that secondary step in screening where you're sitting down with someone, figuring out what's going on. And it has some questions to ask, and it's in a Word so that you can tailor it to your own facility. So now that you've gotten this far and you've screened somebody out or someone has called in sick to work, you've got a symptomatic employee. You don't have an employee with COVID, remember. You have a symptomatic employee. That employee should go and get tested. I should have put that in there. And then they should stay home and isolate themselves until the test results are available. But remember, we're asking people to test with very mild symptoms. So if the employee tests negative, which is actually probably the most likely thing, they can go back to work as soon as they get their test results back. And these days, people are getting test results back within about 2 days, which this whole process depends on really good testing availability and speed. But what if your employee tests positive? This is a no-choice department for all workplaces, whether you're critical infrastructure or not critical infrastructure. Symptomatic COVID positive employees need to stay isolated at home until all 3 of the following are true. Their symptoms have to have improved. It has to be at least 10 days since their first symptom, and at least 24 hours without fever, without the use of fever-reducing meds. So this is a little bit different. Early in the pandemic, it was 7 days. It had to be a minimum of 7 days, but then we found out through experimental, through research basically, that people shed for about 10 days. So people are infected from 2 days before their first symptom until 10 days after their first symptom. And after that, even if they don't feel well, they're not really infectious anymore. So if someone went in to get tested and they didn't have any symptoms, like they just went to a community testing event because they knew they'd been exposed or for whatever reason, they need to stay home for 10 days from the testing date. And there'll be time at the end for questions for anyone that has questions. So what about everyone else? And this is called workplace contact tracing. That is where the employer figures out who that person had contact with. And let me start out with the definition of contact. Contact is defined as interacting within 6 feet of an infectious person for a cumulative total of 15 minutes or more in a particular shift, or 24 hours, or however you want to look at it. So it's not just, it's cumulative, it's a total of 15 minutes. But for critical infrastructure, if all the people involved with this contact were using a face covering, either a cotton mask or a surgical mask and a face shield, or this won't work in vet matter, if all the individuals were using a face covering and there was a physical barrier between them, then that is not considered contact and people don't have to quarantine. So contact, and this is the part that not everyone realizes because it's not written out in black and white too many places, but workplace contact tracing is the responsibility of the employer. And interestingly, the household contact tracing, like if someone has COVID, it's a reportable disease all across the country. So our health department calls everybody, and that's actually how we find out where people work. We ask them where they work and what's their position, when was their first symptom, questions like that. Who do you live with? Who do you have close contacts with? And then those people are asked to quarantine. But in the workplace, you may get a couple of calls from MDH, but after 3 workers in a particular workplace, it gets transferred over to the employer, and we're asking the employer to do the contact tracing. So you are going to look for all the people who had contact with your employee who tested positive, beginning 2 days before a symptom onset until the last day of work. And if they were asymptomatic, then it's 2 days prior to specimen collection date until their last day of work. And of course, the highest risk contacts are those who either work very closely together, reside in the same home. You'd be amazed how many employees live together and work together, eat lunch together, or carpool. Carpooling is turning out to be extremely, high risk. If you carpool with someone who gets COVID, you basically get COVID. That's what we found through all these months of contact tracing. OSHA, and this is thanks to a veterinary clinic who made me, I'm not a big follower of OSHA, but I was made aware of all these rules by a veterinarian, and thank you to you out there if you're listening, that OSHA has basically the same rules, so that made me happy. They made COVID-19 a recordable illness for all employees, and you have to do one of those OSHA 300 logs, and that's easy to find on the internet if you don't already have them. If a case is lab confirmed, work-related, and involves days away from work or medical treatment. And of course, every COVID case that's lab confirmed is going to involve days away from work. That's a requirement. It has to be 10 days minimum away from work. And you must report deaths or hospitalizations due to COVID-19 to OSHA. So what this is telling you is that workplace contact tracing is mandated because you won't know if a case is work-related or not without asking the case and also other employees, where they think they got it and what they were doing during the, incubation period. And you are supposed to keep records for 5 years, even if the case was not due to workplace spread. And I say it in a different part of this talk, but I would say right now that most cases we see in veterinary clinics and in other workplaces are not the clinic's fault. They're spillover from community spread. And we have so much community spread right now that it's not surprising that someone who works for you might come to work and have COVID. But it doesn't mean it's your fault. But it does mean that you have to, pay attention and do these things that we're talking about today. So quarantine is where critical infrastructure varies from other businesses and just ordinary people. A 14-day quarantine for contacts is standard, but we in Minnesota have come up with a shorter return to work quarantine strategy for critical infrastructure that can be adopted to avoid staffing shortages, which would include most vet clinics. What we really like is a quarantine of a minimum of 10 days with testing on day 7, which allows for most people's incubation period, so they will test positive if they, picked up COVID during that exposure. And our less favorite one, but one that is okay, is a quarantine for a minimum of 7 days, test on day 5. This is what most of the meat packing plants are doing, who have really serious staffing shortages. Now, if you look on CDC website, you will see that they put that critical infrastructure people can, employers can ask their employees to work after exposure if, it would be a huge staffing shortage if they didn't, and if they don't have symptoms, and if they wear a mask and do other ramped up safety measures. Now, that is true, but that is not what we would like to see happen in Minnesota. Not quarantining people at all, especially in small workplaces like vet clinics, is not very smart, because what you want to do is nip this in the bud. You do not want it to get going in your clinic and knock a whole bunch of people out so that you can't stay open because you don't have enough workers. And I've seen that happen in 2 different vet clinics that had to close because so many people were sick that they didn't have people who could come to work, included vets. But remember that these actions that you're learning about now, or maybe knew about before, are they follow a COVID positive test only. You don't have to do anything about someone who is exposed to a person with symptoms and who's waiting a test and who didn't get tested. You don't, I mean, everyone has to use judgment, right? But you want that person with symptoms to get tested, and you can wait till their test results come in. You don't have to do anything about someone who was exposed to a person who was exposed to someone with a positive COVID test. And we hear about this a lot, and nope, we really just go from a COVID positive test person and take it from there. Testing is more available now, which allows for this change in guidance from earlier in the pandemic, where they, if anyone had symptoms, you did everything, the same as if the test was positive. So we're going to leave, the screening and the isolation and the quarantine now, and move on to the next most important thing of best practices, and that's distancing. Because again, this disease is spread from person to person through respiratory aerosols. And this business of 6 feet is approximate. It is not written in the Bible or anywhere else. 6 feet is wonderful and almost always effective outdoors. Basically, it's good to go outside. But inside, 6 feet depends if it's safe or not, depends on the size of the airspace and the ventilation in the room. For example, you have 3 people that are technically 6 feet apart in a small conference room having a meeting, and they get COVID because the airspace is small in a small room. And remember this for veterinary clinics, because a lot of the rooms in vet clinics are small. And this is, distancing is very tough in a veterinary setting because of the work. You got to have one person for the animal, another person working on the animal. And sometimes it takes more than 2 people to work on a single animal because the spaces are small. So the best advice I can give you about distancing is to watch your workday unfold. Watch your workday unfold, and watch for areas in the clinic where employees congregate, and wherever possible, innovate fixes that will spread people out. If they're congregating in the pharmacy, congregating in the lab, even if you have to move a microscope somewhere else, if you have to move common drugs somewhere else, to spread them out, use your imagination and try and figure out how to spread people out, because distancing is critical with COVID, even when people are wearing masks. But it is really critical during breaks and lunch when masks are off. So there, you're going to really have to use your imagination now that you don't, have the opportunity to put people outside on picnic tables or whatever you were doing for the summer. You're going to have to do something else for winter, and that may mean chairs where people eat their lunches in weird places. I hate to see people going out in their cars, but maybe some of that, whatever people feel comfortable doing, but they cannot be scrammed together during winter when when you have to eat and masks come off. The next important thing is personal protective equipment and masks. The use of a cotton face mask or surgical mask, has just got to be mandatory and enforced. hard as it is to work all day in a mask, I really do understand this, and I really do feel bad, but it is essential. And I've seen several clinics now in my various dealings now, because like I said, I've had over a dozen clinics helping through this situation with one or more COVID positive employees. And some of the clinics have not really masked. They have only masked if a client comes in the door for something. And some of the clinics have been really religious maskers. And the clinics that have had religious maskers, all of them so far, have had one or more COVID positive employees, and it has not spread to anyone else. And I believe that it is super important. And I know some of the messaging was very weird in the beginning, partly because the personal protective equipment had to be preserved for human health care. But now that masks, especially surgical masks have there's a recent paper to show that they are almost as protective for both the wearer and the other person as an N95 mask. So it's not just source protection, it actually protects the wearer, a surgical mask does. And here's a new idea for most clinics. Whenever possible, when you have to have people working very closely together, use a face shield and a mask. Whenever that is possible and when it's not dangerous because you've got a big dog jumping around or something like that. Wherever you can't use barriers or distancing and you have to work very closely together. And this is actually something that we learned from meat packers. I've learned so much from meat packers and large distributors about limiting workplace spread. And this is one thing that the food processing folks figured out early is if they put both a mask and a face shield on people, basically workplace transmission stopped. And through advising it for various types of workplaces, I'm quite convinced that using both a mask and a face shield is applicable to any type of workplace when people have to work closely together and there's the risk of spread, which is right now everywhere in Minnesota. So consider this for times when it could be useful in your clinic. What was I going to say? Okay, I lost my train of thought there for a second. Since midsummer, like I said before, most new critical infrastructure workplace clusters have been due to spillover from community spread. They're not anybody's fault in the workplace, but you still got to do something about it once COVID is introduced. We want to keep your business running. You know, in our opinion, it doesn't do any public health good to send people home to a community where the virus is spreading. They might as well be at work, right? So this is what we learned from meat packing. Now, obviously, there's a big difference from this from a veterinary clinic, but I just wanted to show you people wearing both a mask and a face shield, and they've got barriers. And basically, we're having almost zero cases in meat packing plants from workplace spread, and very few even from community spread, while the rest of the state is exploding in workplaces. Here again is a look at barriers and people really done up from head to foot in personal protective equipment. It does make a difference. So all of this information together was supposed to bring us to this point of thinking about reopening as it gets colder. So what I was telling vets early on when clients, and they still are mostly in their cars, I've only heard of one vet clinic that's opened up to clients so far. I'm sure there are others. When clients are in their cars, the risk is from coworkers. And that was something that a lot of vet clinics didn't get early on. They were thinking, you know, they know their coworkers, they trust their coworkers, and they would whip on the mask as soon as the client came in for a euthanasia or to pick, you know, meds up or something. So, you know, but the risk wasn't from the clients then because they were in their cars. The risk is from coworkers. But when we start letting clients into the clinic, then the risk is everybody that's crammed into a tiny room called an exam room because they're small and the airspace is small. And if you reopen to clients, this risk has got to be addressed or you will have COVID spread. What I'm recommending is that you put masks and face shields on veterinary personnel, and of course mandate that clients have to wear masks. They can't come in if they don't have a mask. Limit the number of people and the length of time in the exam room, Not that there's any magic to that. Remember, it's 15 minutes cumulative, and it's 6 feet and 15 minutes is not, is not an absolute of anything. Increase the ventilation as well as you can, and make sure that all of your other COVID safety measures are well established. You've got buy-in from your staff, and that you're not seeing a lot of people running around with their masks below their noses, because none of this will work letting the clients back in the clinic unless everything else is ship shape. And the most important thing, again, is employee screening. So you're not letting sick people into the building. And of course, visitor screening, or screening of clients is important too. But I'm going to, I think this is my last slide. I'm going to stop now and I'd love to have some discussion and some questions and see what kind of questions you do have.
A reminder to type your questions in the chat, in the Q&A area, sorry. One of the questions we received is asking about testing. Clinic is indicating that they had an employee who was tested and it took 4 business days to get the results. So is there certain testing sites or locations, or maybe the day of the week that somebody gets tested, that they could get it back within 2 days? Or is it just kind of a crapshoot, for lack of better terms?
The testing is getting better finally, and there's more opportunities for testing. So most of the state-run testing is 24 hours. If you are having really long test times like that, let me know, and we can work through our field epidemiologist and your local county health department to see if we can get that fixed, to see if they can understand that veterinary personnel are critical infrastructure and need to be prioritized for testing. I'm trying to unshare my screen, Nicole. Is it
got to go up to the top there, and it should say stop sharing.
It just says share. It doesn't say actually stop sharing. Let's see if we can. Anyways.
Okay. Well, we'll keep going.
Okay.
Let me just try
I'll leave it on the. I'll put it at the end for the so you can have our email address for critical infrastructure at state.mn.us or my personal email. Either one is fine.
Great.
Okay.
That's good to know how to get ahead in contact with you. So the next question is, okay, we got that. Do you feel that there is, sorry, I've got too many people typing in a lot of questions. Do you feel there's a difference between completely curbside and meeting owners at the door to hand off pets?
No, I don't think. If that is going to work better for you, I don't see that as increasing the risk, really. As long as they don't stand there and talk, as long as you back up and get some distance between you and the client, grab the pet, get some distance, or leave the pet with them, get some distance, do the talking, and then do the handoff.
Okay, great. Somebody would like you to share the link with the Department of Health section that's vet specific. I will include that in the follow-up email I send to everybody. So that, because I know those URLs get really long. So I will include link. So let me just make a note
Nicole.
of that.
There's also a veterinary, I'm sorry, I can't think of the name. There's a guidance just for veterinary facilities or veterinary clinics that just got updated in July, but it doesn't go through the things we went through today, but it goes through the best practices.
Great. Do you have an opinion on the relative effectiveness of the widely available N95 masks versus other options?
Well, I have an opinion, and the N95s, but they really have to be fit tested because there are many different styles and people's faces are different shapes. Men with beards can't wear them at all. I'm fit tested. That's how I go out to plants and stuff and other businesses that are having big outbreaks and see what's going on with my own eyes. But a surgical mask is so close in effectiveness to an N95 and so much more comfortable that I guess that's what I'd recommend. When you wear an N95 for more than a few hours, it's pretty bad, but a surgical mask is slightly more tolerable.
Thank you. Are you recommending testing of non-symptomatic people in clinics?
Anyone who's been exposed and is quarantining should be tested either, test day 7, quarantine 10, or test day 5, quarantine 7, if you've been exposed either in the workplace or at, or at home. However, if you end up with a situation in the workplace where you've got a number of ill people and you had a period where there seemed to be a lot of transmission, I have recommended a few times that pretty much everyone in the clinic get tested. And these are generally workplaces where no one's masking, or the masking is not enforced at all, and it's unclear, where the virus is going and when. And then it can be helpful to test everyone so that the asymptomatic positives get screened out and can isolate at home and not make any more people sick. So, but in general, no. If you've got everything on, if you're following your COVID plan and you're basically following the rules, you shouldn't have to test everyone in your clinic.
Great.
I hope that answered your question. If that wasn't nuanced enough, type in again.
Okay. Do you have any comment regarding the length of time infectious aerosols remain in the environment?
Yeah, the droplets stay alive, stay infectious. Viruses are alive, of course. Stay infectious for like 24 to 30, to 72 hours, and then they're dead. The teeny particles in the airborne tiny particles, apparently they can stay in the air for a number of hours. So let's see. Well, repeat the question for me, Nicole.
It was regarding the length of time that the aerosols remain in the environment. Just if you had a comment
on surfaces, the normal cleaning in a clinic, if you have normal cleaning and disinfection in your clinic, you will be covering that. That's, you will definitely, it's easily killed. It's not a hardy virus. Any kind of cleaning and disinfection kills it. And if you, wiping off your surfaces like most clinics do several times a day, and certainly in the exam rooms and on the counters, in the treatment rooms, you'll be fine. The problem is the teeny particles that are floating around the air after someone speaks or coughs who's infected. And that's why it's not fail-safe, but the screening is critical to keep sick people out of the building. So, because that can stay in the air for hours and hours and be infectious, is what we're finding out now.
Great. I think that's what they were asking, is in the environment. Yeah, the air. So this, have two that are fairly similar, so I'm going to try and combine them here. The saliva tests that are available, are they reliable and cost effective enough that they could have them at their clinic?
They're reliable. They're PCR tests. So they're as good as the nasal, they're almost as good as the nasopharyngeal test, which is the gold standard. So it depends on what you call cost effective. They're over $100. They're being sold right now at Costco and certain pharmacies. And I believe you can buy them directly from the Vault company called Vault, which is the originator of this test, for like $86 a piece at a time. So that's a lot. So I don't know if you call that cost effective or not, but the state testing that's available in the various communities is no questions asked, free, no barriers, no, and that has been nice. And so the saliva testing put on by the state, I don't think is going to cost anything for people. But if you buy the test, they're a little bit over $100. But I do want to say something about the antigen tests, those quickie tests. There's a lot of different ones, and they vary tremendously in their sensitivity and specificity. And they were designed by the companies that made them to be used on symptomatic people. So they're not too bad. If you're symptomatic and you get tested with the quickie test and it's positive, it's pretty believable. But if you're screening everyone in your clinic, no one has symptoms, they're terrible. And most of the positives will be false positives. And then they have to be followed up with a PCR test. So We're not huge fans of the antigen tests at the health department.
Good to know. Is there any value to periodically testing employees for not to try and catch people who are non-symptomatic carriers?
Again, I think the screening is the most important thing you can do. And having employees know that if they have a outside work exposure, like they went to a party and someone at the party had COVID, that they can admit that to you and they can get a test and stay home until the test results come back. So again, wholesale testing everyone just gives you information about what is going on that day, right? 2 days from now, it could be very different. So as a rule, it's not the best strategy. What we're really looking for, this continuous screening and testing strategy that is sustainable over time and is most likely to really keep your business going. If things get out of control, then yes, testing everyone can be useful.
Okay. We have a couple questions very similar regarding masks and asking which is the best mask to use, or if the surgical masks in comparison to 2-layer cloth masks. So could you just kind of reiterate some information about the best masks? Because I believe you were talking about masks and shields if possible.
Sure. So say right off the bat with the masks and shields is those little things that start at your chin and go up to your nose that are clear plastic are useless, and they should be stomped on and broken into 70 pieces because they're no good. The only shield that does any good comes from your forehead and goes down. So that's face shields. It just drives me crazy to see those little ones go up just to here. So they really just collect stuff that's in the air for you to get. They don't protect you or anyone else. So the masking is interesting. One test that I've heard that's kind of interesting is if you can blow out a candle through your cloth mask, it's not substantial enough. So that includes the ones you come up from your neck that are like neck gaiters and you pull up. Most of those are not good enough because they're too thin, but there are some that are thick enough so you can't blow a candle out through them. Masks that are just cotton masks, many of them are very good. If they're, again, just try blowing out a candle through it. And there's a lot of variety in masks, and we really can't do anything about that. People are different in what they can tolerate and what feels good on them. So one company had this great idea when they have employees that just say, I can't wear a mask, is to sit down with them instead of saying, well, go find one that works. Sit down with them with like 5 or 6 different styles of masks and see which one they think will work for them the best. And really spend some time holding some hands to get a mask on a person that they feel is comfortable. I actually had to do this with my husband. What things that go around the ears were hurting his ears, so I found ones that top some of the surgical masks, and that one he wore most of the day yesterday to put in an exhibit at the MVMA office, a Barbie vet Barbie exhibit. As some of you may know, is the historian with the vet history group, whatever they're called. Okay, I'm sorry to transgress. What's next?
The exhibit looks great. I saw it today.
It's funny, isn't it?
Yes. If a clinic is going to start letting clients in the building, do you think safety goggles are effective as a face shield for workers to wear?
We used to have goggles, like if you're wearing both a mask and goggles or mask and face shield for our definition of contact, and we took out the goggles. And the reason we took out the goggles is there's so much variation in the effectiveness of masks that we found that people basically have to have a cloth mask or a surgical mask with the face shield to get the effect that we're looking for, which is basically stopping transmission. So we took out the goggles. If you had a fit tested N95, then goggles are just as good as a face shield.
Um, are all the saliva tests PCR and not antigen?
Yes, to my knowledge, that is true, that all the saliva tests are okay. Which for me is a big relief because I no desire to have stuff, to have a nasopharyngeal swab taken.
Okay. It seems like the state is taking a more measured approach as we move into this new wave of positive cases. Is there any indication that elective procedures, for example, will be restricted at some point again?
No, not if I have anything to do with it. And I've heard no leanings that way, either for human medicine or dentistry or veterinary medicine. We're not seeing that surgery had anything really to do with transmission. And really what that was about was protecting or preserve, not protecting is the wrong word, preserving personal protective equipment for healthcare workers, because there wasn't any back in April and early May, March, April, May. You could not get personal protective equipment for healthcare. And so that is why those elective procedures were stopped, not because of the risk of contact between people. So no, they won't be. Personal protective equipment is pretty much under control now.
Great. Going back to a question about testing and length of time, that if you mentioned that the some of the labs are running 24 hours a day now, why is it still that some people are having to make appointments and then it's still taking days to get the results?
Here, some health systems are better equipped than others to get all this testing done. And anytime you hear that it's like 5 to 7 days, let me know, because there's usually a testing available somewhere in your area that's not like that.
Um, as people are seeing testing being offered in communities, what does it mean when they advertise no barrier testing?
Oh, that means that people who, for one reason or another, don't want to be identified can be tested without having their ID taken. All you have to do is provide a phone number where the results can be sent. Or also if you don't have health insurance. So not having health insurance and not wanting to provide your identity do not stop you from being tested.
Great, thank you. Are there any commercial antibody tests validated? And are these results actionable?
Oh, the results are actionable. That is the weird thing. I'm trying to unshare my screen again. It's not working. The events are actionable. We are acting. Here's the thing that's not quite where it's a little bit different. We are acting on antigen tests as if they were any test. A positive is a positive, but we are providing our data divided out, just so that everybody knows which were PCRs and which were antigen tests. There is some information on which of the antigen tests are best, but again, all of them were designed to be used on symptomatic people, and they're widely being used to screen folks, which is not how they were meant to be used. Even the manufacturers say they don't want them used that way.
Okay, great. A couple more questions. There you go.
I found it.
There you go. Let me just see here. I had some that came into me privately, so I just want to make sure I don't accidentally skip over anybody's question. What do you recommend as far as disinfecting rooms between clients? Should the exam rooms be empty for a period of time between those clients?
Well, it depends on your ventilation, because again, the problem is in the air, not on the surfaces. All you basically have to do is wipe out the surfaces and you're good.
Okay.
You
Is
know,
the test, sorry, go
go
ahead.
ahead. It really
Nope.
depends on ventilation.
Is the test that's up the nose that you mentioned before still practically to your eyeballs?
There's two, the nasopharyngeal goes just like you're tubing a horse or something. It goes up and back to your pharynx. And that one is painful for its own reasons. And then a lot of people who have had the nasal, which is just a swab that goes up your nasal cavity, some people feel like people are going just a bit too far and they're having their brains swabbed. But so they're both uncomfortable, honestly. And one of the problems we're having in large workplaces where they're trying to do, or places like long-term care where their workers are tested over and over, is a lack of enthusiasm about getting tested. So the saliva test.
When a vaccine becomes available, will veterinarians and their staff be one of the first groups to be able to receive it?
No. And I don't think we should want to be. When a vaccine becomes available, just think about it. Who needs to have that vaccine? Number one, it's healthcare workers who are working directly with people who actually have COVID. So, I mean, the highest risk people are people working with human beings who have COVID. So, and right up with them doing, medical things on them. So no, those people need to be vaccinated first. And then there are high risk groups, people who are at risk of being dead if they get COVID, higher risk of being dead. Veterinarians are aware of personal protective equipment, able to protect themselves pretty well. I don't think we should ask to be among the first. I know there's a push from MVMA to do that, but I don't think it's right. And why would we want to, honestly? I mean, don't we want to, how we kind of hang back as veterinarians to see how a vaccine works on animals? Well, personally, that's what as a person who's not terribly high risk, I think it's just fine that the high risk people get vaccinated first, and then we get vaccinated with the second stream of folks. And I'd be interested if someone out there in the audience today has a strongly different opinion. I would like to hear that and understand why. I really would.
Is Lysol spray sufficient if air ventilation is poor?
I don't know the answer to that question. It depends on how well it attaches to particles in the air, and I just don't know. Okay. I think you're better off trying to call in an HVAC expert and jack up the ventilation in your exam room.
Okay. So I'm just trying to make sure I'm getting all the questions asked here. We have an individual who's had to leave active practice, so they're looking for sources for masks that are available. Are surgical masks in good supply currently? If so, could we get a possible contact to buy? If you know of a contact, I could share that with them.
Well, I'd like to hear from the other people who buy for practices, because as far as I know, surgical masks are not in short supply and are able to be purchased just at a veterinary distributor. Is that true? Can someone just type in if that's true?
This person has had to leave practice, so they don't have access to it that way. That's what they're indicating. So is there any other sort of supplier that you're aware of, if anybody's aware of?
I saw surgical type masks at Target yesterday. I mean, I think they're available at drugstores.
Okay, great. Somebody's saying to check Amazon, because that's possible they're available there. We also had a question if you'd be willing to share your slides.
Yes, and I've already sent them to Nicole. Their PDF slides can be.
I just wanted to make sure. I know you sent them to me in case of a
tech
issue, so I just wanted to make sure.
No, they can be posted.
Yep.
And again, the critical infrastructure guidance document is really a step. We tried to make it absolutely step by step. This is what you do if someone's symptomatic, and you send them for testing. This is what you do if they come back negative. This is what you do if they come back positive. So, and then the screening and testing document talks all about screening. So you should, look at those And pretty soon we're updating the one. It won't, the information in it's not going to be updated, but the first paragraph is going to be updated to include, this document includes veterinary medicine, including, construction, veterinary medicine, food processing, so that it's very, very clear that all of us are part of critical infrastructure.
Great. Let me just check for any other questions.
While you're looking, Nicole,
because
everybody, I'm really happy to help anybody's clinic through this. All you have to do is contact me by email, and we'll set up a time to talk. And it's not regulatory. I do not report to OSHA, or it's totally not regulatory. I just share what I can share, my experience so far. I've worked with literally hundreds of workplaces now, all sizes and types. I've learned a lot about how business works in our state, which has been an upside for me. And I am a former mixed animal practitioner plus mixed animal practice owner, partner. So I do look at things from the point of view of a business owner. And I think that is one of the reasons that our group has been successful in connecting with industries and businesses, is because I kind of get where they're coming from. So feel free to contact me if something happens in your clinic and you want help. It can't hurt you.
Yes, I've given out your information number of times for people to get a hold of you.
Thank you.
I say, if not you, it'll be somebody from your team.
Yeah. We actually have a new vet on our team, and I'm going to get her trained in too, because the amount of veterinary business is going up. And her name is Jessica Serban. She's actually not a U of M grad, I'm sorry to say, but she's just joined our team, and maybe you'll get to know her too.
Great. Do you have any recommendations about the best way to communicate with clients in continuing to work curbside?
They want to come in and they don't understand.
I think, yes.
I would be straight up with them and say, we've got, in veterinary clinics are unique facilities because our exam rooms are teeny tiny and the ventilation isn't good. And we want to, in order to keep everybody safe, we just, with the number of cases in our community, we just don't feel we can keep you safe in our building. That's, I guess, how I would put it.
Great. If an employee is over the age of 65, should they still be working based on the fact that they are higher risk?
That is really up to the employee. And I would, what I would recommend is anyone who feels at risk but still wants to work should see if they can work and do their job in both a mask and a face shield. Because you think about it, the people who are doing those horrible nasal swabs we've been talking about, you see them, out there, the cars are going one by one and they're doing the swabs. They're wearing a mask and a face shield, right? Our healthcare workers who are doing seriously dangerous work are wearing a mask and a face shield, and they're, by and large, staying healthy. We have data to show that our healthcare workers who are getting sick, over 55% of them are getting sick from each other, like playing cards at lunch, not getting sick from patients. So it's the social interactions that we so crave as human beings that are our downfall with this disease. So yes, if somebody's over 65 and wants to be as safe as possible, see if they can wear a mask and a face shield. And then, of course, distancing themselves during times when that's off and they're trying to eat and stuff.
I am not seeing any other additional questions. So I'd just like to reiterate that I will include a copy of the slides and the link that you guys were looking for. That will actually also be in the slides. I guess it's already in there. But still, I'll give it so you can just click right on it instead of it being you having to type in the URL. I want to thank Dr. Sheftel so much for her time and energy and knowledge that she shared with us today. And I hope everybody has a hopefully warmer week and stays safe.
Thanks, everybody. I really appreciate your attention. Bye-bye.
Bye. Thank you.